Welcome back to Living 808. February is Heart Month, a time to raise awareness about heart disease. Joining us today to talk about this, the Director of Cardiac and Critical Care Services at Adventist Health Castle, Annette Patelos. Thank you so much for joining us today. Thank you.
Thank you for having me.
Okay, let's talk about Heart Month. You know, why was it started?
So the American Heart Association was formed in 1924, and through the years, it has been documented that women and men are dying of heart disease and not even knowing that they have it. Several years back, it was the #1 killer for men and women. So the American Heart Association decided to put together something called Heart Month, and it's in conjunction with Valentine's Day. And so it's an awareness of taking care of your heart, bringing concerns to your physician if you do have any concerns that you could possibly have heart disease and not know it.
Okay, that's good. What are some of the symptoms that you might have an unhealthy heart?
Yeah, so things to look out for are a lot of weight gain, diabetes. You have to be concerned if you have diabetes with heart disease. If you have changes in your blood pressure, especially elevation of blood pressure, you can go into a lot of the stores, the pharmacy stores have the blood pressure machine. So if you have any concerns about that, I would recommend going in the store and keeping an eye on your blood pressure. That would be a concern to bring to your physician. Any pain in your chest or radiation of pain, especially if you're exercising, would also be something that I would be concerned about.
Okay, are there ways to check your heart? Are there tests that you can take?
There are, besides the blood pressure screening I was just referring to. You could go into the hospital and have what's called a 12-lead EKG if your physician feels that that is warranted. You can have that done. It's electrical tracing of the heart, all the way up to having a stress test done, which stresses your heart to see what's the maximum load that it can take without being overly stressed. You could also have a cardiac catheterization if that was needed. That's where we go in and we actually look at the coronary arteries in a 3-view D image to be able to see what the coronary artery looks like. If we find that there's a blockage that needs to be addressed, then it can usually be done right then and there with a cardiologist on site. If you have coronary artery disease and it's not fixable by a heart catheterization, a balloon angioplasty, or a stent, then you could be referred for open heart surgery. So a full scan of procedures and tests that can diagnose how healthy is your heart.
Okay. Are there people that are at higher risks of heart disease?
Certainly, genetic indicators are huge. Patients with diabetes or obesity or a family history of heart disease, they are much more susceptible than it would be if they don't have any of those precursors.
Okay. Let's switch gears a little bit. Tell us about cardiac care at Kaiser. I know that you guys have such a great department there.
So Adventist Health has an excellent cardiac program. They have put a lot of resources into building a program. We have everything from coming in and having initial services in the emergency department to having diagnostic tests that you could have done, such as an EKG, treadmills, an MRI of your heart. That's also an imaging procedure that we can do for screening, all the way up to the cardiac cath labs, where we could do the angiograms and place the stents, to open heart surgery. We have a full open heart surgery program and an intensive care unit where you would go to recover.
Now, I hear that later this week you guys have a couple of events coming up.
We do. So we have our annual Heart Party. The Heart Party is a recognition of all the patients, since we started our program a little over 3 years ago, that have had heart procedures done at the hospital, primarily open heart surgery. So our cardiac surgeon and other people involved in the heart program are going to be there. We're going to serve lunch, and we're going to recognize all the patients, and it's a great opportunity for them to come back and see the physicians and staff who cared for them, and also to network with other people who have been in the same situation.
Yeah, that sounds nice.
Yeah.
I love that, kind of reconnecting, you know, sending mahalo to their doctors,
right,
and just even for the doctors to check in on their old patients.
Absolutely.
Yeah, that's
yeah,
nice.
It is. It's a nice event.
So it sounds like, you know, Although we're celebrating Heart Month in February, really this is important year-round, right?
Absolutely.
And we want for people to be aware of the signs and reduce their risk of heart disease.
That's right. Listen to your body. It's usually right.
Yes.
And if you have any concern, certainly reach out to your physician.
Okay, Annette, thank you so much.
Thank you.
Thank you for joining us.
My pleasure.
Very important topic, for sure. All right, coming up, Diamond Head Plants wants to help you beautify your home and garden.